You have a lovely family of 4 with 2 amazing kids, and of those children, one seems to be going to the ER a lot more often than the other one. There was a viral infection at the time, and so a lot of kids were affected by this, and you take your son to the ER, and 2 weeks later, you get a bill for around $4,482. Now, mind you, you have a health insurance plan that has a $350 deductible with a max out-of-pocket of $1,750. But how much does it cost to be in the ER with this particular plan that you are paying $1,109 fun dollars per month for just 2 souls, a spouse and a child? Your ER copay visit is $400. The question is this $400 copay covering the entire room or the doctor fees, or does it cover both? The short answer is it just covers the room. How do you know this? Well, you get a medical bill that is supposed to be $271, but with adjustments, you get $79 and $16 off. $175 is your out-of-pocket cost for this claim. This claim, if it says statement of physician services, that's coming from a doctor. So the doctor is the one that is charging you $271. But because you have major medical health insurance, you're getting X amount off, and your responsibility is $175. Without health insurance, talking to a doctor ranges anywhere from $200 to $400. Talking to a specialist ranges anywhere from $300 to $900. Then the second bill that you get is about $4,482. It doesn't cost that much to talk to a doctor, but what this is the actual charge for being in the emergency room. Within the emergency room, the charges are for supplies, pharmacy medication, including the albuterol that was charged for your child who had that viral respiratory infection, a chest x-ray to make sure everything was good, $600. Normally in the days, x-rays were around $200, $300, but now they're $600, and then whatever this is. So you also got to check your health insurance plan. You know you have a PPO, but why does your statement say POS, which stands for point of service, which is one of the 4 different networks that Blue Cross Blue Shield offers? I don't know, but you do have a PPO, and then your statement says POS. So of the charges, you got a $400 copay, and that's what you're paying right here. And then once you reach your deductible, because the deductible has been met within this scenario, $350 earlier sometime this year with one of those 4 ER visits has been met. Once you meet that deductible of $350, that's when your coinsurance kicks in. Coinsurance is 20%. Coinsurance is another fancy word for a second deductible. So once you meet your deductible, the insurance starts paying 80% of the bills, whereas you paid the 20%. And that is where this $63.43 comes from. That's 20% of something. So if ever you have questions regarding your medical bill, just so you're aware, the best time to call the provider, aka a doctor's office, hospital, lab, surgeon's office, is in the mornings. That is when the representatives have the highest willpower and competency level because they just started their shift, hopefully. And avoid try calling in the afternoon because they just want to leave the office. They had a whole day's worth of complaints from the general public. If you got questions on this matter, just shoot me a DM.